Thank you very much, Sue. It's a real pleasure to speak this evening to you all, so thank you for tuning in. Thank you to Sue for the invite. We've given this talk over the last year to different neonatal doctors and nurses, but this is the first time we've had the opportunity to speak directly to midwives, so it's a real privilege for us. So we're going to speak about what, why and who of delivery room cuddles for extremely preterm babies and the parents. I'm going to concentrate on these three, and my colleague Paul will concentrate on the how to go about it. Yeah, thank you. So first of all, let's define the delivery room cuddle. What do we mean by that? It's also known by some as the birthday cuddle. We're really here referring to the chance for a mother to cuddle her preterm newborn before his or her admission to the neonatal unit and our facilitation of this. So what we mean is that the mother's enabled to cuddle her baby in her arms or on her chest, instead of us just showing the preterm baby to her before we whisk the baby away to the neonatal unit. So that the cuddle may appear only a relatively trivial event to some professionals, but it's actually often a huge event in the life of a parent and a preterm baby in their journey. So it typically will follow initial resuscitation or stabilization in the delivery room. The duration, as we practice it, it's usually around 5 or 10 minutes. Sometimes it's briefer than that, sometimes it's longer, but on average it's 5 or 10 minutes. We aim to practice it wherever and whenever possible and irrespective of birth gestation. So our talk today is going to focus on the practice of offering the delivery room cuddle for extremely preterm babies, not because there's anything particularly special about extreme prematurity, but if we can demonstrate that we can do it safely and facilitate it practically in the most extreme preterm babies, then there's certainly no reason why we shouldn't be offering it for all preterm babies. So I'm going to start with parents and end with parents, my session. So here, first of all, directly from Emma. She's a mom of extremely preterm twins, and has a very brief few minutes where she tells her story directly.
They say from the first time you hold your baby, you will never be the same. Your life changes. The love you feel and the emotion is overwhelming. When you have an extremely premature baby, you wish with all your heart that you could experience that flood of emotion the moment they're placed in your arms. You would give anything to hold them the way you have dreamt. Most mums of premature babies don't have the opportunity. They may have to wait weeks, months, or may never get to hold their baby while they're still alive. At 23 weeks pregnant, I was expecting twins. Charlie was shown to me and taken away to the neonatal unit as I was still in labour with his brother Jack. Jack had a more difficult birth, and it took some time to intubate him. This was extremely distressing for us. Once Jack had been stabilised, the consultant asked me if I would like to hold him before they took him to the unit. I instinctively knew this wouldn't be something I'd get to do again anytime soon. Holding my baby in my arms was one of the most special moments in my life. He was so tiny, so perfect in every way, and never in my life have I been so proud and felt so much love. I was completely overwhelmed with emotion. Would any mother turn down the chance to hold their baby for the first time? Jack died from an infection after only 11 days of life. The only other time I got to hold my baby was as he died in my arms. I still find it difficult to speak about to this day, but the cuddle I had when he was born is something I will treasure forever. Jack's twin brother Charlie very nearly didn't survive. It's been a long journey to get him where he is today. He's a happy, healthy and crazy little boy with so much character. He's now 14 years old. Since the birth of my sons, I've been told that being able to hold your premature baby isn't something that every consultant offers. And to be honest, this surprises me. I needed to tell my story to raise awareness about just how much that first cuddle means as a mum. 14 years later, and this still isn't common practice.
So thank you to Emma for her touching and beautiful words, which puts it all into perspective, what this whole concept is about. So we're actually in an enlightened era of family-centred care now, and we know that optimal health outcomes are achieved when a baby's family members are abled and enabled to play an active role in providing the emotional, social and developmental support for the baby. And this active role of parents in providing such support should start right from birth for all babies. We believe that enabling the delivery room cuddle is an ideal way to promote a partnership between the parents and healthcare professionals in the care of the preterm baby from the very outset. If we allow and facilitate mums and dads the chance to cuddle their baby before the baby's neonatal unit admission, that will begin the partnership and can have many benefits. The practice is feasible, can be done safely and is beneficial. We believe it can and should be practiced for most babies born preterm for their benefit and for the benefit of their parents. So what are the potential benefits of delivery room cuddles? Well, we already know there's a mass evidence for the benefits of kangaroo care and direct skin-to-skin contact. And they're multifold, and they include physiological and behavioural benefits, so better thermal stability for the preterm babies, better sleep, augmented breastfeeding rates, early discharge home, and better growth and development. But there are also psychological benefits as well from the parent's perspective, such as more positive feelings towards the baby, lower maternal stress levels, and more confidence in being able to meet the baby's needs. Now, while for extremely preterm babies, the delivery room cuddle, as we practice it, doesn't involve direct, complete skin-to-skin contact, because inevitably the baby's been received into a polythene bag and is swaddled. We believe that some of the benefits are likely to be very similar to those of kangaroo care. It's no surprise to all of you listening that right after birth is an early sensitive period. We know the first minutes and hours after birth are really important for the formation of a tight bond between mother and infant. The concept of this early sensitive period was first introduced more than 4 decades ago. It's a period characterized by a special neuroendocrine situation, probably mediated by oxytocin and prolactin. It's a unique period of increased maternal sensitivity and responsiveness. And if we can facilitate contact between mother and baby in this period, it may improve the quality of the mother-preterm baby interactions and increase the chance of long-term secure attachment. So why should we try and practice delivery room cuddles? Well, first and foremost, mothers and fathers want to cuddle their newborns. Indeed, cuddling the baby in arms after birth is instinctive for parents. We already know that abrupt separation and removal to the neonatal unit of a baby who's already been with mother for more than 6 months is traumatic, and that's mutually traumatic. A calm, supervised initial cuddle, on the other hand, is a marvelous opportunity for us to provide initial reassurance for those parents, for them to meet and form an initial ex utero bond with their baby, and indeed for the baby to feel a first loving embrace. So the parents are then able to touch and kiss the baby, and with our help, they can get the first family photograph and first family video together in those precious moments. We strongly believe there's an imperative that we should try and practice it for the highest risk babies. Unfortunately, it's not still common practice. So Emma, in her section then said 14 years on. We're now talking about 15 years on. We know that on neonatal unit admission, these extremely preterm babies, they're immediately weighed, then incarcerated in incubators and effectively shackled to multiple items of equipment. And all these things effectively preclude early contact and early getting the baby out for cuddles. We already know that if a baby's not allowed the cuddle with the mum before the neonatal unit admission, it's invariably many, many days, if not weeks, before a first cuddle becomes possible. I believe that initial cuddle is especially important for extremely preterm babies because they're at the highest risk of dying, and that can happen suddenly and unexpectedly. So it's a real tragedy if that first cuddle is offered only when a baby is dying on the neonatal unit or when they're terminally ill. And we know from experience that many parents, out of sheer grief, simply cannot bear to hold their baby in such circumstances. And thereafter, they may live with lifelong grief and guilt that they weren't able to hold the baby in such circumstances. So it's a real disaster for all if a baby dies suddenly, never cuddled. So why is it not yet routine in neonatal units in this new century? Well, we've never done it traditionally. We've always felt that there's an immediate imperative to quickly get the baby as fast as possible around to the neonatal unit. There's really been an absent literature and guidance and published evidence of the safety and outcome data, that is, until very recently. There's actually been very few trials giving evidence for the practice. I think fundamentally, we've also had a lack of solicitation of feedback from parents, actually listening to what parents want and need in this situation. But I'm pleased to say it is now becoming more and more routine practice in more and more UK centres. Where it is practiced, I can say without doubt it's been unanimously supported by neonatal nurses and midwives in our own experience. So it's been my own personal practice for more than 20 years. What about the safety? So first and foremost, do no harm. We certainly don't want to be compromising extremely preterm babies. But it's been practiced in our own centre in Norwich for more than 16 years now, irrespective of birth gestation. A bit patchy initially, but it's the norm now. And we don't think twice about it. It's routine to offer it to parents and facilitate it for them. So to try and gather some evidence on the short-term safety outcomes, I did a retrospective review over a 12-year period between 2006 and 2017. And this was a case control study comparing short-term outcomes of inborn extremely preterm babies born at less than 27 weeks gestation who'd had a maternal cuddle at birth. We compared those babies with a matched control group of inborn babies of the same gestation who were only shown to the parents before the neonatal unit admission. And in summary, this is what we found. We found that there's no significant difference in the time of neonatal unit admission or in the baby's admission temperatures on arrival at the neonatal unit. And there was no difference in mortality. So the conclusion was from this small review, case control review, was that offering parents a brief delivery and cuddle of their extremely preterm baby prior to the baby's admission did not significantly delay the baby's admission, nor did it adversely affect neonatal admission temperatures. So when we talk about the cuddles, who should benefit from the cuddle and for which babies should we try and facilitate the cuddle? Well, in answer to that, we would say most babies, and the vast majority that is, of any gestation should be considered eligible until proven otherwise. And this should include pre-viable babies. It should also include babies with anticipated severe congenital abnormalities where postnatal survival is likely to be uncertain, maybe especially important for these babies. There are some babies where it's probably not indicated or contraindicated. So obviously if the mother's been delivered by cesarean under general anaesthetic, it's not going to be possible in those circumstances. Though we mustn't forget fathers in those situations and allow the father to have the cuddle before the baby's taken to the unit. If the mother's acutely unwell for whatever reason or needing medical stabilisation, then obviously her needs take priority, and it won't be possible in many such circumstances until she's been stabilised. May never be possible in such circumstances. If the baby's got expected or an unexpected airway, congenital airway malformation, then it may not be possible. And similarly, if there's prolonged need for ongoing resuscitation, such as need for more volume or inotropic support, then those emergency medical care will take priority as well. But that's the exception of situations. Most of the time, we're talking about when the baby's been stabilised in the first 10, 20 minutes following delivery. There are some more challenging situations which we would not regard as absolute contraindications to delivery and cuddle, such as awake cesarean section, birth of multiples, if the baby's got expected or unexpected cyanotic congenital heart disease, if the baby's born encephalopathic and is required active cooling, and also congenital surgical anomalies. And there was a nice recent paper published just a week or two ago reporting from St Mary's unit in Manchester, a series of babies with a whole variety of neonatal surgical conditions where they've routinely practiced the delivery and cuddle for. And that's open access, and the paper can be downloaded from that link there. So it's all about parents, this, and their babies. And we really, really need to know what parents think about the practice and what it means to them and whether they value it or not, whether they think it's important. So we sought to get some first feedback from parents. We did a questionnaire survey in June 2018, looking back and surveying the parents who'd had a delivery and cuddle in the period between 2006 and 2017. Altogether, we identified 22 mothers of living babies. We didn't invite the bereaved mothers to participate in this survey. We had 12 responses altogether. And the questions we asked were these. So first of all, we asked, how important was that first cuddle to you as the mother of a very premature baby? And we asked them to rate on a Likert scale between not at all important and extremely important. And these were the responses we got. The vast majority felt it was an extremely important moment for them and their baby's lives. We asked them how important did they consider it that the neonatal doctors and nurses, and we should and would add midwives here, we try to offer an initial delivery room cuddle before the baby's taken away to the neonatal unit. Again, we asked them to rate between not at all important and extremely important. And again, the vast majority felt it was really important, extremely important that we try and give that initial cuddle before the baby's taken to the unit. We asked them to comment, if they wanted to, what the first cuddle with the baby meant to them. And here's some of the comments we got back from the mums. So one said, making that initial cuddle as close as it could have been to had he gone to full term to make it feel normal was great. Another mum of a 26-week gestation boy said, it was incredibly important as I did not get to hold my son again for 2 weeks after his admission because he was too sick. So that initial cuddle helped to initiate my breast milk, and I was able to express and eventually breastfeed my son when he was stronger. We got some lovely feedback from mum of a 23-week twin girls where she'd been able to have cuddles with both of them. And she commented, I got a cuddle with both. It was so beneficial to hear them cry and to stop and have that first cuddle was what we needed, as I wasn't going to have another cuddle for a while. And to have that first cuddle, I felt like a mummy. And I was very thankful because I didn't get another cuddle until 24 days later, which again was very emotional to see them and touch them. Maybe it was that first touch was all we needed, knowing it was going to be a really tough journey ahead. I was and am so grateful to have had that first cuddle. And luckily I got that chance. I really hope this becomes the normal thing to have straight after delivering. It's such a powerful connection you have, even at that early on time. And I feel that it's part of why the girls have done so well, because of as much skin to skin I could do from the minute I could. I'd just like to round off my talk by illustrating a couple of video clips here, just showing the cuddle in action in real life. And these clips, precious clips, are shared with the kind permission of the parents involved. So two different babies here, both by chance, both born at 22 weeks and 6 days gestation. So here's the first little baby born in July 2018. It's a real privilege for me to be at this delivery. So I'm just going to play this, and I'll apologize in advance for the beeps of the monitors. It's something you only realize is going on in retrospect, but if you can try and hear through the beeps. The baby's about 26 minutes postnatal here, and it's just being handed to mum.
He's absolutely lovely. He's doing a bit too well, which is why I just asked Sam to turn him down a little bit.
Pull in a little. That's it.
Okay. Just now, keep it on your
Okay.
Just really still.
So what we've got saturations 95.
Heart rate's 170.
Fantastic.
His temperature is perfect.
Super.
You've grown him very well, Mummy.
Thank you so much. Thank you, everybody.
Very good job there. He would have been huge if you'd gone all the way.
So it's early days. So what we'll do when we get round, we need to put some special lines in.
Okay.
Tummy button, so we can give him some sugar solution and then some liquid feed as well.
Okay.
And really important will be, are you planning to breastfeed? Have you thought about that?
Yeah.
That'll be really crucial. If
Okay.
you can get work on overnight, get some milk expressing, and then we can trickle that down into his tummy.
Okay.
We'll be doing an X-ray to check the position of the lines.
Okay.
And then just see how we go, minute to minute, hour to hour, and so far so good. We couldn't have hoped for a better state of him to start with. He's super. And good weight as well. We'll weigh him when we get round.
Yeah, do you know?
We don't know his weight yet.
Okay.
But as soon as we get round, we'll be able to weigh him and then let you know what it is.
Daddy, did you want to stay with Mummy or did you want to go with us?
I stay with you. Go. Yeah. You gonna be fine?
We'll be doing 9 minutes, but you can all sit with him and
Okay.
we can get you updated.
Can talk to him.
Okay.
Tell him bad jokes.
See, she knows that must have said to you now.
Oh my god, yeah, bad dad jokes.
It's just part of being a dad. Welcome to join that club now. Bad dad.
Finally, that's an excuse.
Dad dancing.
So precious moments, and were there part of it. It's a real privilege to be there. This was recorded on the dad's mobile phone. So although obviously we can't in our trust record on our own mobile phones, there's nothing to stop us offering to take photos and videos with the parents' own mobile phones. And the footage is so kindly shared for you all from these parents. So Sheila, the mum in this picture, remember this is a 22-week gestation boy, odds stacked against them at the time before admission, but this little lad came through it all, and he's now 3.5 years of age. And these are Sheila's words: considering how unclear the outcome of his birth was, I can honestly say that cuddling my little lad was probably the most encouraging factor in deciding to express milk for him. And there he is, he was on holiday at the age of 3.5 years, just a few weeks ago. And the other thing that's really important to recognise here is that we don't know, we can't predict the future, which babies are going to survive and which aren't. And it's really important to stress that even a short cuddle, even if it's just seconds or a few minutes, it's really cherished long after the loss of a baby. So again, shared with really kind permission, this is Constance and her little baby who was born last May, same gestation, 22 weeks and 6 days gestation, 460 grams. And this footage is taken on her phone at 20 minutes postnatal. I was very lucky in the delivery room that night. Again, it was a real privilege to be there. I was the consultant present and had such a great team of neonatal doctors and nurses with me. I was effectively redundant. So the team did all the intubations and stabilization. And I was able to act as the cameraman for the mum with her permission and willingness. So here we go.
So we'll tell you when you come over and we'll point you in the right direction. You don't have to guess, it's alright. Yeah. And that's where she'll stay, in the space where we put her. So we know where she is.
So again, thank you so much to Constance and Sonny. At the time this clip was taken, Sonny, the father, was 2 hours away at the hospital, which the mum was transferred in from, looking after their other children, and he wasn't aware of the delivery at this time. And it's so sad, the outcome here. This poor little girl died just 4 days later. And here's Constance's words. She says, "I'm Sonny most grateful for the opportunity to have had a birthday cuddle, and lack words to appreciate you for those pictures and videos. They are forever cherished treasures of her sweet memory. It serves as a means to alleviate our pains on those bad days or the highest moment of grief, and makes those days feel better. The short period of cuddling is better than none at all. If life presents such unpredictable situations, it creates lovely or even a happy moment to cherish in the future. One of the pictures you took is the only and closest shot of her beautiful pink lively face before she became poorly days after." So thank you, Constance. And again, I started with parents. I started with Emma, and this is Emma 16 years ago with her partner. And these are Emma's words. Remember, Charlie survived, Jack didn't. Emma says, a cuddle is so important. Being able to hold Jack right after birth meant the world to me and was so special. It's the hardest thing in the world not having your baby near you after delivery. You hold on to that one cuddle you've had. That cuddle I had with Jack when he was born meant so much, and all mums should have this opportunity. That's how I'd like to end. All mums should have this opportunity. So I'd just like to thank all those parents without which we'd have no talk, and we wouldn't be able to share this presentation with you. And I'd like to thank all my midwifery colleagues in Norwich and doctors and nurse colleagues here in Norwich who've been a unanimous support of this practice over many years.
And welcome to everybody who's come this evening. I think we've got an interesting evening. I hope you're going to enjoy it.
I remember another patient who we both looked after, who, you know, was in a relationship with a chap, getting serious, thinking about starting a family. And I remember her bringing him to clinic, him getting tested, them coming back to get the results. He was trait. This was one of our patients who had sickle cell disease, and she dumped him in the room.
Yes, she did.
Dumped him in the room in front of
us.
I remember.
And I said, Mummy, I would never let you get a vaccine that is not safe. So I'll be the first one there, and then once I've had it, you can have it. And I remember this text message coming back to me while I was at work, well, you'll be the first to die. But every touch point, be talking to women about the importance about having the vaccine. And if you don't have information, say that to somebody. I don't have the information. Can I pass it on to the person that can?
Some women are saying that they're actually having a really positive breastfeeding experience because their situation of having to stay at home and not having lots of visitors around and not feeling they have to rush about everywhere means they've actually got the excuse almost to sit on the sofa and just breastfeed their baby.
So Black and brown women and birthing people are not treated with equity, leading to unacceptable levels of morbidity and mortality. They then become marginalised communities that become mistrusting of maternity services, and they might be reluctant to engage because their initial experience has been negative. We then label them as difficult and unwilling to engage, and the cycle of substandard care continues.
It's really difficult to describe really what makes continuity happen, but there is some real magic in the depth of relationship that you have with a woman and her family, and it's really beyond articulation. We know it works. It definitely works for our women and our families, and if you always put them in the very centre of what you do and how you work, that is when the magic happens.